Welcome to everybody. I'm not going to say good morning or afternoon because I think everyone's in all different time zones. So I'm going to be talking today about optimism and the role of optimism in health. Our world is rapidly aging, and largely because we have done a phenomenal job of understanding how to extend the lifespan. But what researchers have really been focusing on now that we've learned how to extend the lifespan is extending the health span. We want people to live long lives, but we want them to live their lives in good health and well-being. And it's really only very recently that we've come to appreciate how much our behavior and attitudes can actually impact our physical health. So this really is an international concept. I will focus today on optimism. So I wanted to introduce you to the cohort that I have worked in for literally decades, mostly to give you a sense of how we do this kind of research. There are many other cohorts like this one, but I just wanted to give you a sense of how these kinds of projects get done. So we divide women up, so as I said, we give all the women, so 100,000 women in the study, that optimism scale. We then, just for simplicity, there are no rules in the optimism scale of, what's quote good or what is bad. But we simply divide women up into even quartiles. And what we start out doing is try to understand patterns that go along with optimism. So for example, you can see that 14% of the women with the highest level of optimism went on for their master's or doctoral degrees, and about half of that, about 7% of those with the lowest levels of optimism have master's or doctoral degrees. And in contrast, bad health is less common among women with higher optimism. So this is now simply starting out just looking at lifespan. So simply how long the women live. I did include here briefly, these lighter blue bars are the women in the nurses' health study. These darker blue bars are men from a sort of brother study. Compared to those in the lowest quartile of optimism, each increasing quartile increases lifespan. These next data are on the health span. So again, on the bottom we have women's optimism scores. And now what we have here, this curve is representing their likelihood of healthy aging. So again, not just aging, but healthy aging. So healthy aging is good memory, absolutely no major diseases, and good ability to take care of themselves on a daily basis. And here you can see again that as optimism increases along this scale here, their odds of healthy aging are really increasing too. When we think about if there could be novel ways to keep people healthy, in fact, there are ways to kind of intervene on optimism, meaning even on a kind of a population basis, research has found that if you give people relatively basic exercises, for example, if you ask people every night to write down, 5 things they're grateful for, their optimism level can improve. So if you, sort of push people a little bit into thinking of themselves in the best possible way, it has been found that you can get their optimism levels to increase. So we're not just studying optimism as a sort of abstract concept, but actually as a public health intervention. If we could get people to increase their levels of optimism, how might this actually increase their levels of health and well-being, into older ages? I also wanted to talk about, some new and interesting ways we're trying to use social media to do health research. So we've started to think about ways maybe to increase the diversity of the research we do and increase the people we can attract to participating in research if we make it really easy and just use social media data. We actually started in the nurses' health study, a really brand new project just in the last year or so, to try to understand how we might use Facebook. So just to summarize and conclude, we really are gathering a lot of evidence that a relatively basic sort of behavior or attitudinal factor like optimism has a potential to be a really powerful tool for finding ways, to increase longevity in our population, but even more importantly, to maintain health and well-being as people get older. Similarly, if we can identify simpler strategies to identify optimism in populations, it really could expand our opportunities for more research and discovery.